welcome to today's episode of Epworth Live. We're joined today by Jen, who's an emergency physician here at Epworth Richmond. And today we're going to be talking about children and the emergency department. If you have any questions, feel free to pop them in a comment below and we'll get back to them either during the episode or as soon as possible after. So I guess we'll kick off with, when should you take a child to the emergency department instead of the GP?
So I guess we'd say you should come to the emergency department if you're worried about your child. We know that parents are usually the best judge of whether their kid is sick or well or hurt or just not quite right, not quite acting like their usual self. If you can get in and see a GP pretty quickly and be reassured by that, great. But if you can't get in and see a GP, then we're here 24/7 and open for business and always happy to see children and provide, reassurance or treatment or investigations or tests or whatever is necessary at the time.
Great, and what would you find are the most common reasons that children end up in the emergency department?
Yeah, so sort of depends a little bit on the age group of the child. Certainly in the smaller kids, so babies into toddlers, we see a lot of children with fevers, and it can sometimes be a bit of a hassle trying to figure out what's wrong with the kid, whether it's just a simple cold or virus affecting their upper respiratory tract or something more serious. So fevers are common, gastro is common, coughs and colds and bronchiolitis are common, infections that are picked up in daycare and school, we see a lot of those. And we also see a lot of the accident side of accident and emergency, so broken bones, trips, twists, falls, cuts and lacerations, that sort of stuff.
Okay. And when a parent is on their way to the emergency department with their child who could be a bit distressed, what would you recommend? Are there any tips for sort of talking to the child about the emergency department and preparing them for what's going to happen?
Yeah, so you can certainly try to prepare them prepare their expectations for what they're going to find in the emergency department. We always recommend that if you can, parents bring in items that might comfort the child, so they could bring their special blanket or their teddy bear. If they feel safe and comfortable and able to sleep in their pram or stroller, then by all means bring that in as well. What we would tell them to expect would be you'll be seen by a doctor and a nurse. They might have some special machines to check things like your heart rate and your temperature. They might give you some medications to make you feel better, and we might do some tests. So we might take an X-ray of bones or catch a sample of your wee or something like that.
And what will happen when you arrive at the emergency department?
Yeah, so first things first, when you arrive at the emergency department, you'll see the triage nurse first. They do a quick assessment, maybe check some vital signs, decide whether the child is really sick or really injured and how urgently they need to be seen and sorted out. After that, usually we'll grab some details off mum or dad or whoever's with the child, so name, date of birth, Medicare card, private insurance, and the GP's details. They're quite important because we like to make sure that the GP is really kept in the loop about what's happening with this kid. And then shortly after that, you might go through to our waiting room, or you might get brought straight into the paediatric area of the emergency department. So we've got 4 beds in a treatment room tucked away around the corner, specially staffed with paediatric trained nurses and dedicated doctors on shift, all shifts, who are allocated to see the children as they come.
And when you do arrive at the emergency department, will there be a long wait, or do children have priority? How does that work?
I reckon we're pretty good at getting our children seen and sorted out. We know that it's a potentially distressing time for them, and we like to try and prioritise them. So usually, once we've seen them at the triage area, we'll do whatever we can to get them into the department and treated from there. And that might be getting some pain relief on board quickly, particularly in the case of broken bones or injuries, or something maybe to help with nausea and vomiting, or some fluids or something like that. So we like to get things started quickly. So yeah, our kids get priority.
Great. And can a parent accompany the child the whole way through?
Yeah, absolutely. Yeah. So we would certainly encourage that, and that's going to be best for the kid and best for the parents as well. So mums and dads can go with their kid, they can go to the x-ray, they can pop on a lead apron and have their picture taken at the same time. Because that's always reassuring to have mum and dad there. So we would always encourage them to stay and stick around.
Yeah, and that would be the same if a child had to stay overnight?
Yeah, so if a child gets admitted, then they can have a parent stay overnight with them in the room. I know that they provide sleeping arrangements and meals and everything for the parents while they're in, and that certainly helps reassure children as well that they won't be separated from mum and dad if they need to come in.
Yeah. And what happens after leaving the emergency department, whether that's a child's been admitted or they've gone home?
So if the child gets admitted, they'll be brought up to our paediatric ward, which is also staffed by dedicated paediatric nurses and our paediatric medical and surgical doctors. And their treatment will continue depending on what their problem is here. If there's any, if children are sent home, we try to make sure that they're followed up and seen by someone. So that might be the GP. So a letter will go off to the GP explaining what we've seen and what we've done. And we will certainly encourage parents to take their kids to the GP as a follow-up, to make sure that treatment's helping, that they're getting better from the gastro or the viral illness. Or sometimes we arrange for people to come back into the emergency department to be reviewed by us, ideally by the same doctor, so that we can make sure that, again, treatment's progressing and the kid's getting better and they're comfortable. Yeah.
Okay.
I guess that's a good point to mention things like if we do a plaster, we might bring people back for a plaster check the following day just to make sure that it's not too tight or cutting off the circulation and that it fits correctly. So that's sort of one of the planned reviews that we do.
Okay, great. And what would you say are the differences between going to a public and a private emergency department?
Yeah, so overall I would say that our private emergency department is a calm and quiet place most of the time. Sometimes it gets a little out of hand. We know that our children's hospital provides a great service to the children of Victoria, but it's often very busy, and often people are concerned about the amount of time that they might spend waiting to be seen by a doctor or a nurse. If you're sick, and you get seen pretty much straight away, but for people who are not quite needing to be seen as urgently, they might wait a long time. But what we try to do here at Epworth is see our kids as a priority and get them sorted out regardless of what they've presented with. So we do prioritise them and get them seen and sorted out. Yeah.
Great. Thank you so much for your time today, Jen.
It's my pleasure.
And thanks to everyone for joining us. If you have any further questions, feel free to put them in a comment and we'll get back to you later on. And remember to like Epworth on Facebook to stay up to date with the latest Epworth Live episodes.